Hello friends, let us now learn some important points about the Lobar consolidation. So, in the Lobar consolidation, as the name says, here the consolidation will involve either a single lobe. So, if you see, this is the right lung, this is the left lung, this is the heart, this is the dome of the river, the dome of the diaphragm, right dome of diaphragm, left dome of diaphragm, and this is the heart here. Now, the consolidation, if it involves the entire lobe, either the upper lobe, middle lobe, or lower lobe, then we call it as lobar consolidation. So here, the consolidation is involving one lobe or more than one lobe. Okay, so if this entire lobe is involved, then obviously below it you will see the presence of fissure. So this is one important landmark which helps you to identify that it is lobar consolidation. Okay. How does this lobar consolidation occurs? So what happens is, this is one alveolus, this is other alveolus. If you remember the anatomy, the different alveoli are connected to each other by certain pores. There are certain pores in the walls of the alveoli which helps the alveoli to connect from one alveolus to other. And these pores are called as pores of Kohn. These are called as pores of Kohn. So with the help of this, there are these pores of Kohn which are small holes present in the alveoli. So whenever there is an infection, because this lobar consolidation is most commonly seen in some pneumonias. Okay. So in pneumonia especially whenever there is some infection. So the infection which is present in one lobe, this infection will pass from this lobe to the next, from this alveoli to the next alveoli through this pores of Kohn. And from there it reaches the all alveoli until the fissure is reached. So this will result in involvement of complete lobe of the lung, which is called as lobar pneumonia. This is because the organisms which are present in this lobar pneumonia or lobar consolidation is that they will produce thin secretions, and these thin secretions will actually pass through these pores of Kohn. So as a result, when they pass through these pores of Kohn, this will result in the lobar pneumonia. One more important thing is that sometimes there might be involvement of fissure also. Sometimes this uh, consolidation may involve the upper lobe or a particular lobe, and also a part of the fissure also. When a part of the fissure is involved, or a complete fissure or incomplete fissure may be involved. So if there is some incomplete fissure, this will result in bilobar pneumonia. This looks like bilobar because of this fissure and involvement of two lobes. Then we call it as bilobar, or if two fissures are also involved incompletely, then we can call it as trilobar pneumonia or trilobar consolidation. Then one more important type is that this type of spread of pneumonia or spread of consolidation is not just seen in infectious conditions but also in some neoplastic conditions. If this is the alveoli, And if these are the pores of corn, then pores of corn, then one important thing is that if there are any carcinomas, like especially in adenocarcinoma of lung, whenever there is adenocarcinoma, that too mucinous type of adenocarcinoma, the cells, malignant cells, can spread from one part of the alveoli. They might involve one alveoli first, and slowly they spread into other alveoli and one more alveoli. Like that, they spread into the whole lobe of the lung, resulting in lobar consolidation. Okay, so this is also seen in mucinous adenocarcinoma, that is invasive mucinous adenocarcinoma, or it can be seen in lymphoma. Okay, but here this alveolar spread is not just in pores of corn. Why? Because it is, what do we say? These are cancerous cells. These cancerous cells starts filling the alveoli, and then through these they enter and they fill this alveoli again, and slowly these cells, these alveoli are completely filled with these cells. And they're not just in the pores, even through the walls also they can come out. They can even spread through walls. So this mucinous adenocarcinoma can spread through walls of alveoli. They can also spread through the pores. They can spread through anywhere, but they can spread and they can involve the whole lobe, or in fact, they can even involve the whole lung also. Okay, then one more important thing is that when there is some pneumonia or atelectasis, and that has caused bronchial obstruction. When there is, number one, bronchial obstruction, and along with this bronchial obstruction, if there is some pneumonia because of this obstruction, that means first there is bronchial obstruction, and this bronchial obstruction has led to either pneumonia or it has led to some atelectasis. Then also the whole lobe, because if this is a right bronchus is obstructed, so this whole liver, sorry, whole lung is becomes whitened out or consolidated, right? So why is there this bronchial obstruction? This bronchial obstruction can occur whenever a neoplasm or cells obstruct the bronchi, or if there are any lymph nodes, especially the hilar lymph nodes, if they undergo enlargement, if they enlarge and if they can obstruct the bronchus, or whenever there are some inflammatory lesions which can cause bronchial obstructions, or strictures can cause bronchial obstructions. So all these can cause bronchial obstructions resulting in pneumonia or atelectasis. Okay, next. Next, whenever one more important cause of lobar obstruction is if the patient has acute myocardial infarction. And because of this acute myocardial infarction, in myocardial infarction, the heart undergoes infarcted. Why? Because there is some blood vessel block, either anterior descending artery might be blocked, or right ventricular artery, right coronary artery or left coronary artery, anterior descending artery, marginal artery, anything must have been blocked. So because if the artery which is supplying the heart is blocked, so as a result, the area which is supplied by this part of artery undergoes infarction. So that is myocardial infarction. That is the part of the heart which is supplied by this artery will die, and that results in infarction. So whenever there is acute myocardial infarction, there are in the ventricles there are some papillary muscles. These papillary muscles might rupture. Okay, these papillary muscles, what is the main important work of them? These papillary muscles will there are valves present actually. There is these valves which are present. These valves are attached to the papillary muscles. So when the walls are, when the valves, these are valves, the between the right atrium and right ventricle, we have the tricuspid valve, and between the left atrium and left ventricle we have the mitral valve. When there is papillary muscle rupture, these papillary muscles will hold the mitral and tricuspid valve and keep them in their positions. When they become ruptured, the mitral valve or tricuspid valve might undergo prolapse. So you can see the prolapse of mitral valve more commonly, resulting in mitral regurgitation symptoms are seen. Okay, this can occur. So whenever there is mitral regurgitation, mitral valve is present between the left atrium and left ventricle, we have mitral valve. So there is mitral valve prolapse leading to mitral regurgitation, where the blood from the left ventricle will regurgitate back into the left atrium, and slowly there is back pressure to the pulmonary veins. So because of this, there is back pressure. You can see the presence of back pressure to pulmonary veins, and this back pressure will because of this back pressure to pulmonary veins, there is increased hydrostatic pressure. That means in the pulmonary veins there will be increased blood. So as a result, there is increased hydrostatic pressure present in the pulmonary veins. So as a result, the water will the blood or transudate, actually water will reach the alveoli, resulting in this consolidation of that particular lobe. Right? Then sometimes, has already seen, the lobar consolidation can also be due to some uh, infections also. So this is about the lobar consolidation. Thank you.